Healthcare Options Infectious Disease Podcast. I'm your host, Tiffany Hensley McBain. Today's episode is the first of an ongoing series on addressing misunderstandings and applying HBV treatment guidelines. This series features brief conversations between a physician and a patient in which they discuss ways to collaborate in care and reach shared decisions, often describing their own experiences. In this episode, Dr. Grace Wong from the Chinese University of Hong Kong has a discussion with her patient, Ms. Chan, who shares her perspective on starting treatment for hepatitis B infection during her pregnancy. Please note that Ms. Chan speaks Cantonese, so this conversation was re-recorded in English with her responses unaltered. For more information about Dr. Wong and for a link to additional online education on this topic and more, please visit the link in the show notes. Now let's get started. Dr. Wong, would you like to introduce yourself and Ms. Chan?
Hello everyone, my name is Grace Wong. I'm a hepatologist from the Chinese University of Hong Kong. Today, I'm glad to have my patient to share her experience of hepatitis B. We will refer her as Ms. Chan to protect her privacy. Hello, Ms. Chan. Firstly, I would like to ask you about the first time that you had the diagnosis of hepatitis B.
Because I was born in mainland China, it was about the age of 4 to 5 when I was in kindergarten. My school helped us get some blood tests, and so I found out that I have hepatitis B.
So, Dr. Wong, is it common public health practice to screen school-age children for hepatitis B infection in Hong Kong?
Interestingly, no. In fact, because Ms. Chan was born in mainland China, so that in fact the practice there was a bit different from that in Hong Kong. I know that in mainland China they screen the school kids as well as some young adolescents or young adults before they start working. But in fact, in Hong Kong there has not been a very systematic screening program for school kids. Instead, we have very comprehensive assessment for all the pregnant lady as a part of the routine antenatal test. So I would say that in Hong Kong, most of the time it's the young lady, the mother, who will first be screened for hepatitis B. And usually the school kids will not be screened unless there's any known family history, then maybe it's the parents initiated such kind of screening for the kids.
Right. So then, Ms. Chan, it sounds like your experience was different. You got screened as a child.
Right. So then my mother got a checkup, and later she found that she actually had hepatitis B.
Oh, I see.
So I believe it was through transmission mother to child that I have this disease.
Right, and Ms. Chen has monitored her condition regularly after knowing she has hepatitis B. In fact, her condition has been stable all along. Therefore, before her pregnancy, she did not have any indications of active hepatitis or that medications were needed. And before your pregnancy, you actually discussed with doctors about whether to have treatment or not. But before that, you just monitored the condition. You were not pregnant at the time, but did you worry about your HBV infection and continue to be monitored rather than treated?
I had a bit of concern that the disease would get worse because the test results at that time showed that the viral load was quite high.
If the clock could turn back to the time you were just having regular checks before pregnancy, would you have preferred that your providers do anything different?
I just hoped the condition would not get worse or could be controlled.
Right. And later you were pregnant. And did the hepatitis B make you worrying during your pregnancy? And what was your concern?
Yes, I was worried that the hepatitis B would transmit to my baby.
Yes, that's understandable. Did the doctor at that time follow the international guidelines, which indicate that hepatitis medications can be considered when viral load reached a certain level? So it can reduce the viral load and significantly lower the chance of transmitting the disease to the baby. When the doctor explained the choice of medication, was there anything special that made you get worried or hesitant?
I was a bit hesitant, and I was afraid of medications because I didn't know if it would affect the growth or if it would make me uncomfortable during pregnancy.
Yes, that's a very understandable concern.
But on the other hand, I did know that the treatment was safe and it can reduce the risk of transmitting hepatitis B to the baby.
So, Dr. Wong, Ms. Chan transitioned to your care at this point prior to her pregnancy, correct?
Yes, correct. Because Ms. Chan knows about a new initiative, a special clinic in my hospital that we have very comprehensive program with regular monitoring for pregnant lady who may need or has been put on antiviral treatment. So that's why she was referred to us before her pregnancy. I think this is a good plan because we do have more time to really explain what is going to happen, and that's why when she got pregnant and when we discussed about whether she need treatment, she were very well prepared psychologically.
So you did recommend that she start treatment prophylactically during her pregnancy?
Yes, because at that time, I'll review her blood test results over the past few years. She had remained to have positive hepatitis B antigen, and her viral load was high, well above a million IU per mil, which has been like that for a few years. So that's why I explained to her that likely during her pregnancy, she will have such high viral load. And that's why, according to the latest international guidelines, antiviral treatment will benefit her and her baby by reducing her viral load and much reduce the chance of transmitting the virus to the baby.
Okay, thank you for explaining that. So in general, how do you incorporate your patients into shared decisions regarding their HBV treatment? And how did you approach this discussion with Ms. Chan?
Yeah, in fact, in our mother-to-child transmission clinic, we have very comprehensive education program provided by our hepatitis nurse, who is specialized in taking care of ladies with hepatitis B. So that's why they will have been educated, receive quite a lot of updated information about the disease itself, as well as how would the infection may possibly be transmitted to the baby, and what would be the treatment options according to the latest international guidelines. So in fact, before the ladies come to see us, the hepatologists, in fact, our hepatitis nurse already explained a lots of things to them, and then the doctors like myself, when we see the pregnant lady again, they will then share with us any of their concerns after hearing all the information, which sometimes can be quite a lot to the mother. So in fact, they may ask us, most of the time it's about the safety of the medications. Then we can again show them some of the data from the international registry and so on, and from our own experience. And after addressing their own concerns, we may allow them to have some time to think about it, because usually it would be during the first or early second trimester of their pregnancy, they will still have some time to think about whether they really want to start the treatment. Sometimes they can make the decision right away, but sometimes they may need a few weeks for that. And then we will arrange another visit before the beginning of the third trimester, so they can make their final decision. If they're willing to take the drugs, then we will prescribe the drugs, and then to cover the whole third trimester of pregnancy, as well at least a month after delivery. And then we will invite her to come back regularly during the third trimester, as well as post delivery, to really closely monitor whether she is tolerating the drugs well, as well as any other side effect or any issues. As well, after stopping the drugs, is there any post treatments, biochemical flare, and so on. Okay, I'm interested to know though, Ms. Chan, do you have any suggestion to doctors for improving your experience during treatment of hepatitis B, or helping the overall monitoring and treatment all along?
Yes, I might suggest a platform to help patients like us learn from the experiences of other patients. I also think learning our daily life or dietary habits could have helpful ways to improve our condition.
Yes, I agree.
Well, thank you, Ms. Chan and Dr. Wong, for that discussion.
Yes, thank you, Ms. Chan, for joining us today.
And thanks to our listeners for joining us. As a reminder, if you would like to view a short presentation by Dr. Wong or presentations of other topics related to the care of hepatitis B, I invite you to visit the Clinical Care Options website by clicking on the link in the show notes. And please be sure to check back regularly for more episodes on important infectious disease topics. Thanks!